Early prostate cancer signs, a vital topic that can have a life-altering impact on you or someone you care about. Many people don't realize that prostate cancer is one of the most commonly diagnosed cancers among men worldwide, and while alarming statistics show that about 1 in 8 men will be diagnosed at some point in their lives, the real concern lies in how often the early warning signs are overlooked or mistaken for less serious conditions. If caught early, prostate cancer can often be managed effectively and, in many cases, successfully treated, which is why it's crucial to stay informed about any subtle changes your body might be signaling. The fact that symptoms can be silent or vague only heightens the need for awareness, and it's important to remember that early detection can be the difference between a more favorable outcome and a difficult, sometimes devastating journey. Before we move further, if you find this information valuable, please like, share, and subscribe to our channel. Doing so helps us build a community of health-conscious individuals who can support one another with accurate, research-based knowledge. By taking that small action, you may help someone else discover these signs at a stage when intervention can truly make a difference. Prostate cancer, in its early phases, can remain undetected because the prostate is a small gland situated deep in the pelvis. For many, subtle urinary symptoms or general discomfort might not raise alarms until the disease progresses further. Sometimes there is a misconception that only older men need to worry about their prostates. While it is true that the risk does go up with age, studies indicate that vigilance should begin earlier, especially if there is a family history or other risk factors, such as certain genetic predispositions or lifestyle factors like smoking and poor diet. Understanding this backdrop sets the stage for why we're here, to unpack the 8 most common early signals that might indicate a prostate issue, highlight how each symptom could connect to prostate cancer, and provide guidance on what steps to take next. In the spirit of making this an engaging and informative conversation, let's delve into the signs without making this feel like a mere list of dry facts. Instead, imagine this as a journey through the body's subtle language, exploring how different discomforts, pains, or changes could be its way of asking for your attention. Now that we've underscored the significance of the topic and invited you to help spread the word, let's glide into the specific warning indicators you'll want to keep an eye on, and you may notice how seamlessly awareness transitions to action once you realize the importance of each sign. Among the earliest signals is frequent urination, especially noticeable at night. You might initially dismiss this as a common inconvenience, perhaps attributing it to simply drinking too much water before bedtime. However, research suggests that 50 to 60% of men over the age of 50 experience increased urinary frequency linked to the prostate, either due to benign prostatic hyperplasia, BPH, or in some cases the presence of malignant cells. The National Cancer Institute underscores that while frequent urination alone doesn't confirm prostate cancer, it's worth investigating if this symptom persists, intensifies, or disrupts your daily routine. Another early red flag comes in the form of a weak or interrupted urine flow. If you find yourself standing at the toilet longer than usual, or if the stream stops and starts repeatedly, it could be more than just a sign of aging. A growing prostate, whether from cancerous or non-cancerous causes, can press on the urethra and obstruct the normal flow of urine. This sign is considered significant enough that urologists often ask about urinary flow when discussing prostate health. Continuing this thread, the presence of blood in urine or semen can be a startling symptom. While it is less common than some others, its potential implications are serious. Blood can appear as a faint pinkish tinge or manifest as darker spots, and even minor traces should prompt you to consult a healthcare professional. Though it may also indicate infections or other urinary tract issues, medical authorities like the American Cancer Society advise immediate evaluation if blood is detected, because delaying could mean allowing a more serious underlying condition, such as prostate cancer, to progress unnoticed. Equally important is recognizing potential erectile dysfunction, ED, as an early sign. Although ED can arise from various factors, ranging from stress and cardiovascular problems to hormonal imbalances, it can also be associated with prostate cancer. Certain studies suggest that approximately 40% of men diagnosed with prostate cancer may encounter sexual performance challenges earlier than they'd anticipate. If you experience new or escalating difficulties in this area, it's prudent to consider a range of causes, including your prostate health, rather than simply attributing it to aging or everyday stress. Then there is the matter of persistent discomfort or pain in the pelvic region, including the area between the scrotum and anus, which some people describe as a dull ache that refuses to subside. Such discomfort might not be severe enough to trigger alarm bells, yet ignoring it could mean missing a critical clue. The pelvic region houses several structures closely linked to the prostate, and chronic pain in this area can hint at inflammation or possible malignant growth. Researchers note that many patients delay seeking help for these subtler pains, increasing the chance of discovering the cancer at a more advanced stage. Painful urination or ejaculation is another warning sign that tends to get overlooked or attributed to a straightforward infection. While urinary tract infections or prostatitis can certainly cause a burning sensation, persistent pain during urination or ejaculation can also point to something more concerning. Timely testing to rule out prostate cancer or to catch it early is essential in such cases, especially if the pain does not resolve or keeps recurring. Some men also report unexpected weight loss, which, according to oncology experts, can sometimes signal advanced prostate cancer. Weight fluctuations happen for many reasons, but a sudden drop without deliberate dieting or extra exercise is always worth investigating. Your body may be under stress from a serious underlying condition, and addressing this sign can be a powerful step toward early intervention. Lastly, pay attention to persistent pain in your lower back, hips, or upper thighs, as these areas are common sites for prostate cancer to spread if it advances beyond the gland. Experts at the American Cancer Society often highlight this symptom as one that can be easily mistaken for arthritis or muscle strain, leading men to delay medical evaluation. While not every ache in these regions equates to cancer, consistent or worsening pain that resists typical treatments deserves a closer look. Having covered these 8 signs, frequent urination, weak or interrupted urine flow, blood in urine or semen, erectile dysfunction, pelvic pain, painful urination or ejaculation, sudden weight loss, and lower back or hip pain, you can see how each one carries implications that might align with a prostate issue. Now that you've gained insight into the warnings your body might be sending, you might wonder what steps to take if you experience any of these signals. The beauty of early awareness lies in the practical actions that follow. When you catch symptoms sooner, you can address them promptly, increasing the likelihood of positive treatment outcomes. Consulting a doctor quickly is vital, and this straightforward step can sometimes feel daunting if you're anxious about the possibility of a cancer diagnosis. Yet remember that medical professionals are there to help, equipped with tools such as the Prostate-Specific Antigen (PSA) test, which checks for elevated levels of a protein in your blood that can indicate prostate issues. Although the PSA test isn't foolproof, it can generate false positives or miss certain cases. It still serves as a critical screening mechanism that, when combined with a digital rectal exam, DRE, or imaging, provides a fuller picture of your prostate health. You should also consider adopting a healthier lifestyle if you're experiencing any of these signs, or even if you're simply aiming to prevent them. Research links balanced diets, rich in fruits, vegetables, and foods containing antioxidants like lycopene, found in tomatoes, to lower risks of prostate cancer, while regular exercise helps regulate hormone levels and bolster overall immune function. Some studies hint that a consistent routine of physical activity can reduce cancer risk by improving circulation and supporting the body's natural detoxification processes. Equally crucial is managing your stress, since chronic stress can compromise immune responses and potentially accelerate disease development. Reducing or eliminating habits such as smoking while moderating alcohol intake can further safeguard your prostate and overall health. With these strategies in mind, let's slide quietly into the concept of prevention, because focusing on prevention today might save you from a more challenging diagnosis in the future. Prevention strategies often begin with a diet that emphasizes whole grains, lean proteins, and an abundance of colorful produce. Scientists have increasingly spotlighted the Mediterranean diet, which includes fish high in omega-3 fatty acids, olive oil, nuts, and plenty of fresh vegetables, as a beneficial approach for overall health, including prostate health. The Harvard School of Public Health suggests that men who combine healthy eating with regular exercise may reduce their likelihood of several chronic diseases, not just prostate cancer. In fact, 30 minutes of moderate exercise most days of the week can create measurable differences in how your body regulates and manages cellular growth. In addition, understanding your family history can be a powerful preventative step. If prostate cancer runs in your family, especially among close relatives like a father or brother, your personal risk can be significantly elevated. Medical experts recommend starting screenings earlier, sometimes as early as 40, if you know that genetics may be a key factor. This might include a baseline PSA test, which can then be tracked over time to detect changes more effectively than a single test alone. Moreover, it's essential to stay aware of common risk factors, such as obesity and smoking, both of which can spur systemic inflammation and changes in cellular behavior. By addressing these factors early, through regular checkups and lifestyle adjustments, you can potentially limit the chance of malignancy developing or progressing undetected. This mindset aligns seamlessly with the broader movement in medicine that emphasizes prevention and health maintenance over crisis management. Though it might feel like a lot to keep in mind, these preventative measures fit naturally into a balanced, health-conscious routine. You'll likely find that many of these steps, like eating well and staying active, offer benefits beyond prostate health, from improved cardiovascular function to better mental well-being. Now that we've explored both warning signs and the next steps in handling them, plus a range of preventative strategies, it's time to consider how to stay motivated for the long haul. Health routines often require consistency, and it's easy to slip back into old habits when life gets busy or stressful. However, remembering that early intervention and proactive care can mean the difference between a health challenge you can manage or one that manages you can be a powerful incentive. Encouraging a friend or family member to join you in these lifestyle changes can also help, because mutual support can make a big difference in sticking to new routines and keeping each other accountable. With that perspective in mind, let's bring our conversation full circle and highlight the essential points that can guide you toward better health outcomes. Ultimately, paying attention to subtle bodily changes, like frequent urination, a weak urinary stream, blood in urine or semen, erectile dysfunction, unexplained pelvic or lower back pain, and even unexpected weight loss, can empower you to take early action. These signs don't exist in isolation. They're part of the body's communication system. Sometimes the simplest clue, like noticing you wake up more often at night, can be the first step toward discovering something that requires medical attention. Screening is your ally in this process. The PSA test, while not perfect, remains a valuable tool, particularly when used in combination with other diagnostic methods. Regular checkups become even more critical if you have a family history of prostate cancer, as genetic predispositions can put you at a higher risk. Healthy lifestyle habits, from a well-rounded diet to consistent exercise routines, may help reduce that risk, and avoiding detrimental behaviors like smoking or excessive alcohol consumption further decreases your chances of encountering serious health issues later in life. Above all, maintaining open communication with healthcare providers is crucial. Don't hesitate to ask questions, seek second opinions, or request further testing if something feels off. Being proactive can spare you from a scenario where you discover cancer only after it has advanced. By prioritizing prevention, you give yourself the best shot at evading or minimizing the effects of this disease. It's easy to feel overwhelmed by the volume of health advice out there, but focusing on these foundational steps, awareness, screening, and lifestyle, can simplify the process. Remember, prevention doesn't mean living in fear. It means equipping yourself with knowledge and acting on it before a problem escalates. Just as importantly, share this knowledge with those around you, because prostate cancer awareness doesn't stop with one person. When conversations about men's health become more open and honest, more people get screened in time, and more lives can be saved. In closing, always keep in mind that being alert to these 8 early warning signs can change your health trajectory in profound ways. And don't forget to take the next steps if you notice anything unusual. Please remember to like, share, and subscribe so that this vital information can reach others who may need it. You never know whose life you might save by simply passing along the message. Early detection truly is a game changer, and staying informed is half the battle. Thank you for watching and learning with us. Together, we can foster a healthier, more aware community for everyone's benefit.